Awesome, awesome. So welcome everybody. Thank you so much. We're going to go ahead and get started. Um, Once again, today's webinar is Climate Change, Health Equity Among Minority and Vulnerable Populations. Today's presentation is hosted by Region 1. My name is Faith Steele, and I'm with Region 1. That's at the University of Maryland, Baltimore, I should say. I'm also joined by my co-host today and colleague, April Wright, also of Region 1, and we will be moderating today's session. Before we introduce our speakers, we got a few housekeeping notes. And first is a reminder that everyone has been muted and their cameras are off to cut down on background noise and save bandwidth. So.
Okay, great. Thank you, Faith. So if you have any questions or comments, please go ahead and enter them into the chat located at the lower right-hand corner of your screen. Also, remember to select everyone in the chat for comments intended for everyone. We'll leave time for questions at the end of the presentation. Also, this webinar offers closed captioning. So, we have live captioning, and you can find it in the multimedia panel located near the chat panel. You may need to scroll down in the box and click the link to start the live caption stream. Finally, today's session will be recorded and made available for future viewing on YouTube. Now let's talk a bit about who we are. The National Institutes of Health is the nation's leading medical research agency. And many of you might be familiar with the National Institute of Allergy and Infectious Diseases. And it's one of the many institutes of the centers at NIH. Now, the National Library of Medicine is also an institute at NIH. It's the world's largest biomedical library, which maintains and makes available a vast print collection and produces electronic information resources like Medline Plus and PubMed. NNLM is the network of the National Library of Medicine and is the outreach program of the NLM. The NLM is made up of seven regions, and each in the mission is to advance the progress of medicine and improve public health by providing all U.S. health professionals with equal access to biomedical information and improving the public's access to information to enable them to make informed decisions about their health. Region 1 is based of the regions. It's based at the University of Maryland, Baltimore. And NNLM provides free webinars and classes and funding for health outreach projects and access to a network of public and academic libraries, community and faith-based organizations, and universities. Now, in today's presentations, you will, by the end of it, you will be able to identify the principles of environmental justice, describe how the environment may play a role in health outcomes for communities of color and vulnerable populations, and discuss the intersectionality between climate change, health inequity.
Thank you so much, April. So today it's our pleasure to welcome our featured speakers. We have Ms. LaDawna Walker-Dean and Dr. Georgiana Logan. Mrs. Walker-Dean serves the state of West Virginia through the West Virginia Minority Health Initiative that was formerly through the West Virginia Office of Minority Health, and it's under the auspice of Marshall University Minority Health Institute, with community investment, addressing health disparities and health equity at the forefront of the West Virginia initiative. Additionally, she is the founder of the West Virginia Minority Health Fairs to help individuals be healthier by seeking to engage the public in discussion about common health issues and access to free healthcare services provided by healthcare organizations and businesses throughout West Virginia. Dr. Georgiana Logan is an associate professor at the College of Health Professions at Marshall University, a research associate within the Minority Health Institute, and current director of the Writing Across the Curriculum program in the Center for Teaching and Learning. Dr. Logan serves on several academic committees, state-level committees, national committees, and efforts to address a range of health topics, including health disparities, health equity, men's health, environmental justice, and fatherhood. Additionally, she is the founder and executive director of the Men's Health Equity Institute, a nonprofit organization that serves as a research and health promotion learning collaborative that provides education, research, service, policy initiatives that raise awareness about men's and boys' health and well-being. Thank you both, Donna and Dr. Logan. Thank you for joining us today, and I'll turn everything over to you to get started.
Thank you. Thank you so much, Faith, for that warm introduction. Thank you to your team for just inviting us to be able to come and speak to you a little bit about climate change, environmental justice, and what the heck does all that stuff mean anyway, right? And so we're going to go ahead and get started. And so we've already been introduced as well as we could ever be introduced. I am Dr. Georgiana Logan. And so you'll be hearing from me first, and then you'll hear from my colleague, LaDawna Walker-Dean, a little bit later in the presentation. And as you've already saw, some of the learning objectives, so by the end of the presentation, we want you to be able to identify principles of environmental justice. We want you to be able to describe how the environment plays a role in health outcomes for communities of color and vulnerable populations. And we also want you to be able to discuss the intersectionality between climate change, health, and equity. And so when we think about acts of environmental injustices and things that's going on in the US, these things are not new, right? There are headlines popping up all over the world. Things going on in Flint, Michigan with the water crisis, pollution, poverty, and people of color, asthma in the inner city, things in West Virginia where me and LaDawna is currently located, right? The Atlantic Coast Pipeline, the list goes on and on. If you type in environmental justice, you'll see many news headlines that pop up with some kind of issue or another, whether it's related to climate change or environmental justice. So what we want you to know and kind of get an understanding about is that what do we know about our environment, right? We're talking about environmental justice and climate change. And the environment is a leading determinant of health and well-being, right? Many people on this call have probably heard of social determinants of health or the conditions in which people are born, grow, live, work, and play and pray that affect a wide range of health outcomes, right, for individuals and communities. So when you look at this concept of environment, you have to include both the physical and social environments, as well as the interactions and connections between those environments. What the heck am I talking about, right? So when we talk about our physical environment, that's your land, your water, your plants, air. When we talk about your built environment, we're talking about actual physical infrastructures, right? Your buildings, your parks, your roadways, highways. And then your social environment has to deal with your social cohesion with the individuals who are surrounded in your community. They all go hand in hand. And so, since we're talking a little bit about environmental justice, let me give you a definition. So, the Environmental Protection Agency, or the EPA, defines environmental justice as the fair treatment and meaningful involvement of all people, regardless of their race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And so, therefore, when you hear us talk about environmental justice, we're addressing the disproportionate environmental risks by low income communities and communities of color, resulting from poor housing, poor nutrition, unsafe neighborhoods, lack of access to health care, or underemployment, and employment in some of your most hazardous jobs, right? And so I think this graphic is so befitting because it says, "My neighborhood is killing me." What does that mean? And so sometimes if you let me tell you a story if you don't mind, right? So sometimes when we talk about all of these different concepts and ideas, it's always great to have a historical foundation about how things came to be. And so when we talk about environmental justice, this movement, it actually started not too long ago, right? A lot of times when we talk about injustices that have been done, people think they happened 100 years ago. Well, if you think about environmental justice, it tells you right here it started in 1982 in Warren County, North Carolina, in the small community of Afton, right? 1982. Y'all, I was born in 1984. This is not that long ago, right? And so what happened was the government decided they wanted to come in and dump this toxic soil in this community. And so community members were outraged, right? We don't want this soil laced with these chemicals in there. You know, that stuff gets down into your water, your air, your soil. And so the community members, they really wanted to just start protesting, right? Nonviolent protests. And so what they end up doing, they laid down in the road to prevent these dump trucks from coming into the community that was leading into this landfill, to try to prevent them from being able to dump this soil. As a result, most often when people protest, right, people were arrested, you know, some people got injured. And this led to the first arrest in the US history over the sitting of a landfill, right? Ultimately, the people in Warren County and Afton, they lost their battle. The toxic waste was eventually deposited in the landfill, and you can just imagine some of the health outcomes that happened as a result of this. And this is just the beginning. If you're really interested in environmental justice, and then different events or things that have happened throughout history, you can go to the EPA website. They have this nice graphical timeline where you can look at events from Cesar Chavez, in the San Joaquin Valley in California, to events that happened in Chicago where 2 children were killed. The list goes on and on. It's a nice laid out timeline about how the environmental justice movement came to be. Which leads us to, so eventually, you know, people, what do? We get fed up, right? When so many injustices and things keep happening to you, we start to speak up, we start to advocate. And so the first national people, delegates to the first national delegates to the people of color, which comprised of Asians, Native Americans, Hispanics or Latinos, African Americans, and Pacific Islanders, they met in Washington, D.C. in October of 1991, and they had an environmental leadership summit. And while there, they drafted and adopted 17 principles of environmental justice. I'm not going to read all of them to you, but please know this is a public document, so you can go and find these 17 principles. They make up so many foundational efforts to many grassroots initiatives that you see today when you talk about community programming centered around environmental justice. It's 17 of them, 17 principles. That's important because, again, we talk about history, right? This led to President Clinton in 1994 signing an executive order of federal action to address environmental justice in minority populations and low-income populations. So we ended up forming this Office of Environmental Justice, and then they got this executive order signed by President Clinton. And again, you can go and read this whole executive order. It's a whole PDF, right, with lots of good, rich information and what all it included. And so when we talk about environmental justice, you also got to talk about environmental injustice and environmental racism. So when we talk about environmental injustice, we're talking about the disproportionate exposure to pollution and its effects on health and the environment, as well as the unequal environmental protection and environmental quality provided through our laws, regulation, government programs, enforcement, and policies. That's your EPA, right? We also talk about this term called environmental racism. And I know people hear the term racism and we get uptight, right? But we have a lot of isms that impact health and health outcomes for people, especially low income and communities of color. So when we talk about environmental racism, it's any environmental practice or policy that differentially affects or disadvantages, whether intentionally or unintentionally, right? You did it on purpose or you didn't mean to do it at all, individuals, groups, or communities based solely on their race. And so a lot of times when we talk about environmental injustice or environmental racism, we look at it through the lens of what we call an overburdened community. So those are your minority, low income, tribal, or indigenous populations, or geographic locations, right? West Virginia, we're rural, that experience disproportionate environmental harms and risks that contribute to environmental health disparities. You say, Georgiana, what you talking about, right? So when we talk about environmental health disparities, these are when your low income and communities of color experience poor health outcomes as a result of climate, pollution, and what have you, more frequently than wealthier, less polluted communities. So we're talking about increased rates of asthma, obesity, poor housing, more lead exposure, differences in urban and rural terrains, extreme weather events, and the resiliency to be able to combat some of those stuff that you go through, and poor birth outcomes. So when we talk about asthma, in case you didn't know, people of color are more likely to experience disproportionate exposures to particulate matter and ozone air pollution, whether we're talking about secondhand smoke, dust mites, cockroaches, moles, whatever you can find, in this, particularly in these areas, right? Which leads to African American and Hispanics having the highest rate of asthma. I tell you that Black children are twice as likely to be hospitalized for asthma and are 4 times as likely to die from asthma than their white counterparts, right? So you see this graphic with these asthma disparities. When we talk about obesity, we know that cardiovascular disease, right, is a leading contributor to death or mortality among communities of color. And so predominantly minority communities in rural areas have fewer grocery stores. We talk about lack or access to fresh fruits and vegetables, food deserts, and they're less accessible to affordable, healthy foods, right? If you have a lot of convenience stores in your areas, you pay almost 2 times as much for a loaf of bread, a banana, apple, whatever the case may be. Poor neighborhoods disproportionately lack outdoor recreation spaces that are safe and offer few opportunities for biking and walking trails that leads to higher rates of obesity among communities of color and low income populations. When we talk about housing, we know that most times in America, still to this day, many communities remain segregated by race, whether it's through zoning laws, redlining, the old term, if we want to talk about that, it still happens, right? And then the harmful effects of government-backed segregation produce racial inequities and increased exposure to environmental hazards that we still witness today. I tell you on my slide that black households are 3 times as likely as whites to live in older, deteriorated, or dilapidated, crowded, and substandard homes with building code violations. They experience severe problems with heating and cooling, plumbing, electricity, and maintenance that lead to a lot of those dust mite, asthma, things that we see that's associated with asthma, right? Cockroaches, mold, and etc. And this contributes to infectious and chronic diseases, injuries, and adverse child development outcomes. Lead, we know that it's estimated 3.6 million American homes with at least one child have significant lead hazards, right? Why is this important? So if you lack access to fresh fruits and vegetable grocery stores, we know that if you have increased levels of iron, calcium, vitamin C, D, zinc, and magnesium, those combat the effects of lead absorptions that people may be experiencing who live in those conditions. When we think about our workplace, right? When you talk about traditional occupational hazards, where a lot of low income, minority, or migrant workers work, they're often faced with not only physical hazards, such as exposures to different things in the environment where they work, but also physically demanding tasks or environments. And so I tell you that occupational health inequities are avoidable differences in work-related disease incidents, mental illness, or morbidity and mortality that are closely linked with social, economic, and or environmental disadvantages, such as work arrangements, contingent work, socio-demographic characteristics, and organizational factors, right? And then a lot of times people don't think about how the environment affects pro-birth outcome for pregnant women. And if you look at this graphic, this is a picture of my co-host LaDawna's newborn baby, JJ, as we call him, her Power Ranger. He was born preterm birth, right? We're not saying that it was this poor environmental quality things that are going on, but it may have contributed in some form or fashion. So we know that environmental pollutants can have a detrimental effect among economically disadvantaged and minority populations, whether they experience some exposure to secondhand smoke, exposure to air pollution, lead, pesticides, what have you may. We know that historically and presently, Black babies are 2 times more likely to be born preterm, low birth weight, and to die within their first year of life than their white counterparts, which is kind of sad. When we think about our rural areas, West Virginia is a rural state. Rural areas often mimic many of the health challenges associated with environmental injustices faced by minorities. So you'll see later on when LaDawna presents, West Virginia is a primary Caucasian state or a white state. They make up like 96, 97% of the population. It's a lot of them, right? So we're talking about our low income white counterparts that's experiencing poverty, unemployment, low wage work, limited education, abandoned housing or poor housing, limited access to health care. We have the health reform, and luckily Medicaid was expanded in our area, but we also talk about, lack of access to broadband internet, right? People can't access their telehealth visits, which really showed where we stood during the COVID pandemic. Obesity, food insecurity, agriculture exposure, health information and technology, which I just kind of talked about. When we talk about extreme weather events, so those are your hurricanes, your floods, tornadoes, and your ability to bounce back from those events when they happen, right? Many low income and minority communities don't have the resources in place to successfully bounce back for adverse extreme weather events. Whether we talking about not having health housing insurance, no flooding insurance, lack of extra money just saved up to kind of combat or offset some of those property damage or injuries once they occur. And so the Environmental Justice or Environmental Protection Agency, or the EPA, they have an Environmental Justice Action Plan. So this was just finalized in September of last year. So much like the Healthy People 2030 initiatives or the Healthy People initiatives that they put out every decade, the Environmental Protection Agency puts out an Environmental Justice Action Plan every 5 years. And then you can go online and read about their plan in detail. But what I want you to know that this plan includes four main goals. They want to strengthen compliance with cornerstone environmental statutes, and they go well into more detail than on this PowerPoint slide when you read about it. They want to incorporate environmental justice considerations during the regulatory development process. They want to improve community engagement in rulemakings, permitting decisions, and policies. And they are charged with implementing President Biden's Justice 40 initiatives. If you haven't heard about it, please go look it up. They have a huge role that they play in this thing. And since I told you me and LaDawna are over here in West Virginia, we have to talk about environmental health in our state and what that looks like for us as practitioners working to address some of these poor outcomes that we see in low income and minority populations. So what do you think West Virginia is known for? What are we known for in terms of industry? Do you know? I'm pretty sure most people probably have some kind of idea, but we're known for the coal industry, right? Our coal mines. Yes, I see Cecilia popped it up there. Come on, Faith, y'all got it, right? Keep whining. So, what health outcomes are associated with that industry? Do you know? What do you think health outcomes are associated with that industry of coal mining? What do you think? Black lung cancer, yes, COPD, breathing issues, asthma, right? All of these things we're thinking about, talking about. So, what other environmental injustices has West Virginia faced? We already have the poor worst health outcomes out of all U.S. states. And LaDawna's going to tell you, we can name them all. It's crazy what all is going on in West Virginia. But if you look at the headlines again, we are making waves in the headlines. I'll just read off a couple of them. They say life and death in a toxic town. The residents of Minden, West Virginia have been living and suffering on contaminated land for more than 30 years. They want out, but it's not that easy. And the town of Minden, West Virginia has a really cool kind of like historic, I talked about this historical background. Go and look up Minden, West Virginia, and see what really happened to the individuals in this community and their high rates of cancer. And it's still nothing that hasn't been, they haven't been declared as like a hazard nationally. And why is that so? West Virginia counties among worst in nation for drinking water violations. And these stories are not that old. We're talking about 2019, 2020. You see the picture of the bathtub. They have the lead from different things flowing in through the water. Health risks in West Virginia for oil and gas, air pollution. Majority of West Virginia counties rank worse in the U.S. for water quality. We rank worse for everything across the board, right? We need a lot of funding in West Virginia to address those issues, which leads me to Bloom's taxonomy. So a lot of times you hear about Bloom's taxonomy like in education. Well, I use it in public health initiatives, right? We have to move beyond just telling people, hey, this is something that you need to be knowledgeable about. Here are the facts, the basic concepts. We need to be able to mobilize communities and individuals to create, develop, investigate what's going on in our communities. How are we going to be able to fix it? How do we put programs and policies in place to make sure that we have the best possible health outcomes for individuals in the communities, primarily our vulnerable, low income, and minority populations that myself and LaDawna work with? And so I'm going to turn it over to LaDawna as she takes you a little bit further in our discussion on climate change in West Virginia, and then our public health approach to understanding health for us. What does that look like in our work? What are some of the things we've been able to do over the last few years? And what are some of the things we're expecting to be able to do as we move forward to address health for vulnerable and minority populations in our state?
Hey, thank you, Dr. Logan, for giving us that insight very well about climate and how we can address it through policy. Thank you so much. So I want to take it away with leading it, talking about specifically West Virginia. Okay, and so we're going to talk about climate change in West Virginia, a public health understanding approach to understanding health. And so a lot of people think quickly about West Virginia. Where is West Virginia located at? Is West Virginia part of Virginia? I know a lot of people on this chat can kind of understand where I'm coming at with that. Where is West Virginia? So I'm a visual learner. And so I've actually had these two maps on here to let you all know exactly where West Virginia is, where we're located at. And on your left side, my right side screen, West Virginia actually borders 5 states: Ohio, Pennsylvania, Maryland, Virginia, and Kentucky. And so over to my right, which would be your left in the United States. So West Virginia is a little state right here. And so we're not Western Virginia, we are West Virginia, 2 different states. So I wanted to kind of bring that to people's visual understanding. And moving on, climate change in West Virginia. Dr. Logan, she did a great job of talking about definitions, about climate and justice and environment. So climate justice ensures that people and communities who are at least culpable in the warming of the planet and most vulnerable to the impacts of climate change do not suffer disproportionately because of historical injustice and disinvestment. Climate change has the worst effects on people who have low health equity, those who do not have adequate opportunities to be healthier. The risks of climate change are not spread equally among people in cities, states, countries, or globally. And lastly, though we are all at risk to the health threats of climate change, some groups are more vulnerable and thereby less resilient to the health threats. Climate change in the environment in Appalachia. So the Appalachian region is a 205,000 square mile area that stretches and covers all of West Virginia and parts of 12 other states. So the Appalachian region, the 12 states that are included in Appalachia, for those of you who did not know, they're Alabama, Georgia, Kentucky, Maryland, Mississippi, New York, North Carolina, Ohio, Pennsylvania, South Carolina, Tennessee, and Virginia. Individuals who reside in distressed Appalachian regions have higher odds of reporting poor health outcomes than residents of non-Appalachian regions. These findings are further exacerbated when looking at minority and vulnerable communities in these regions. When we talk about distress, we basically refers to regions in the worst 10% compared with the nation as a whole, in terms of a 3-year unemployment rate, per capita income, and poverty. Today, Appalachia has high rates of poverty, low rates of education, high rates of unemployment, an aging population, limited access to health care, high rates of, you guessed it, cigarette smoking, and generally poor health statuses. So the West Virginia Department of Environmental Protection enforces state and federal environmental laws in West Virginia to help protect our air, water, and land. Every state should have this type of protection, and you guys should be enforcing it as well. It covers Division of Air Quality, Office of Oil and Gas, Division of Water and Waste Management, Division of Mining and Reclamation, and Division of Land Reclamation. I didn't know about this until Dr. Logan and I started to research this. I didn't know that we actually have it in each state, the protection to help us with environmental protection. So it's so good to know what your state has regarding to environmental protection. And also it offers a citizen's guide to climate change, which is a 16-page document written by the West Virginia Climate Alliance Group, which documents the causes and impacts of climate change in West Virginia. And so what I do is I'm the program director over the West Virginia Minority Health Initiative, which was formerly the West Virginia Office of Minority Health. Each state, by legislature has to have an Office of Minority Health. A lot of states are actually transferring that Office of Minority Health to health equity, which is access to all. That means everybody, despite what they look like, despite what their income is, despite where they live at, each state has to have a minority health, which basically protects the health and well-being of racial and ethnic minorities. If your state does not have it, that's why it's so important to know the laws and legislature out there in your states. West Virginia actually has a law, like with other states, a healthcare disparities law. West Virginia does not have that law in place, but other states in the United States do. And that's another story that we have. Hopefully Faith can invite us back and we'll talk about policies and legislation among the healthcare disparities that actually includes environmental disparities as well. But our purpose is to serve as a resource and collaborative partner to community organizations, healthcare providers, and government agencies in efforts to decrease morbidity and mortality in minority populations. And lastly, what it is that we do here at the West Virginia Initiative and at the Minority Health Institute is we coordinate statewide efforts to reduce health inequity, just like environmental health disparities. So Healthy People 2030 defines a health disparity as a particular type of health difference that is closely linked with social, economic, and or environmental disadvantage. Health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on their race, their ethnicity, their gender, their income, their disability. And so basically, we're here to advocate on these individuals and populations that have systematically experienced greater obstacles to health based on what they look like. So religion, socioeconomic status, gender, age, mental health, that I said before, sexual orientation, geographic location, or other characteristics historically linked to discrimination or exclusion. So we talked about briefly, Dr. Logan touched on it, the West Virginia population and demographics. So Census 2020, the most recent updated census, 1.8 million people reside in West Virginia. 89% of the people who reside in West Virginia are Caucasian. And that number drops significantly when we talk about minorities. African American and Black make up 3.7% of the population, which equals to roughly 66,000 African Americans live in West Virginia. We come down closer on this graph, you see American Indian, Alaska Native, 0.2%. And that number, of course, gets lower with the ethnicity of Hispanic and Latinx roughly represents 1.9%. When you talk about environmental disparities, African Americans and minorities, exclusively low-income whites, are bearing the burden when it comes to poverty, when it comes to cancer, when it comes to type 2 diabetes, for example. African American males are dying at an alarming rate in West Virginia. As we know, type 2 diabetes is a preventive disease, meaning if you exercise, if you eat healthy, then you can actually prevent having that type of disease. And so that leads to environmental disparities in West Virginia. So we're going to talk about infant mortality. As you can see, you list these 9 health disparities. The top 9 people are the minorities are being affected and they're dying by these disparities. Infant mortality, if you see, 6.5% of whites actually had the health disparities of infant mortality by race. African Americans, look at that number, 12.3 are dying. And that's why it's so important to know what is going on with our environment, how we can actually deal with actually decreasing this number. But it's very staggering to know this number. And then when we talk about United States, that number is even higher. And cardiovascular disease, we talk about smoking. Well, in West Virginia, individuals who smoke, basically number 2, African Americans rated number 2 with actually smoking. When we talk about cardiovascular, we talk about COPD. The numbers are striking. In here, you see West Virginia, white alone, not Hispanic, Latino, 258% actually were dying of cardiovascular diseases per 100,000. If we look at African Americans, we know there's not 100,000 African Americans that live in West Virginia, 66,000. So if you look at that, 272.5% are dying of this disease, it's really staggering. And as you look at all the other minorities in this category, we are actually higher in Asian Pacific Islanders is higher than the national average, just like Caucasian and African Americans. And so climate justice and environmental justice impacts on farming. People think farming and environmental, what is the difference between? There's no difference, because if you don't have farming, you don't have anything. So the National Black Farmers Association is a nonprofit organization representing African American farmers and their families in the United States. As an association, it serves tens of thousands of members nationwide. And NIMVA's education and advocacy efforts have been focused on civil rights, land retention, access to public and private loans, education, and agriculture training and rural economic development for Black and other small farmers. Well, in West Virginia, McDowell County Farms is a farmer cooperative association that works to bring exposure and awareness to the agriculture opportunities that exist within the region and to provide farming training as a means of economic development in an area of the state facing issues such as high employment, poor health, and a lack of access to healthy locally grown foods. Now, what's very interesting at McDowell County is that was a coal mining county, the southern coal fields of West Virginia. And what happened actually several years ago when the coal mining industry collapsed because pollution and whatnot, what actually needed to back it up with that when the coal mining closed down? Can anyone go in the chat and tell me what happened when those coal mining industries collapsed in West Virginia? What came about? Okay, so we have opiates. Yes, McDowell County stricken with opiates because there was nothing to actually take up for the closing of the coal mining. So people lost jobs, they lost their homes, which leads into depression. And we can get into all of that other stuff. So this actually, McDowell County Farms was founded by Jason Tart and is the only minority ran farming in the state of West Virginia, which is located close to McDowell County. And so therefore, with this farming brings what? More jobs in agriculture in the area that is needed, because the coal mining, it was good on an economic stance and financially it was great, but it actually polluted our economy. Thanks for entering the chat. And so next at the Institute, we decided, okay, what can we actually do to actually bring access to healthy foods? So we developed a community garden initiative. Cabell Huntington Hospital in Cabell, West Virginia, actually donated $25,000 to the Office of Minority Health, which is the West Virginia Minority Health Initiative. And these are some real live pictures of what our garden used to be pre-COVID, before COVID hit. And so basically we partner with the YMCA, Positive People Association. And Positive People Association is a minority-owned organization in Huntington, West Virginia, which is Cabell County, West Virginia. And some of the goals were to develop and promote community gardens to promote healthy eating. And so community garden continued. So in Huntington, West Virginia, in the top, if you can see my cursor, this is Huntington, West Virginia. This is kind of our Scotland. This is where me and Dr. Logan reside. So there are no grocery stores in predominantly Black African-American neighborhoods. Charleston, West Virginia, which is the capital of West Virginia, there are no grocery stores in the predominantly Black African-American neighborhoods. And so this is when we talk about income and economic disparities. And you come over to these two top corners right here, which you have Jefferson County and you have Martinsburg County, which is in the eastern panhandle of West Virginia. They do have grocery stores in the minority communities. And so when I was doing my research, what is different? We have people to advocate to make sure that there are grocery stores in minority communities, to make sure that people are actually having access to healthy eating. And we can talk long about this, but just so we're pressed for time, we can go back and revisit this about disparities as it relates to Black neighborhoods and minority communities in the state of West Virginia. And so moving on, Take Back Our Health West Virginia. Dr. Logan is a founding board member of this initiative. And at the core of Take Back Our Health West Virginia is a commitment to policy, systems, and environmental changes. Policy, systems, and environmental changes, also known as PSE change, describes an approach to preventing chronic diseases such as diabetes, cancer, hypertension, and obesity that focuses our attention on transforming the wider social and institutional context that determines health and well-being where we work, live, and play. In policy change, I won't read it all, refers to change in guidelines, principles, know your policies in your particular state. Systems change refers to a change in the approach, behavior, and activities of an organization or group of organizations that contributes to community health at the scale of a population. And lastly, we have environmental change, which refers to a change made to the physical landscape, infrastructure, or built environment. And so back in 2019, as I was hired on in 2018, I figured, what can we do to talk about and build up the environment in West Virginia? And so we researched, we advocated, and so we met with the constituents of the Herbert Henderson Office of Minority Affairs, and they actually granted us, we actually applied for a pilot grant. We were awarded $25,000 for the Bridge Grant, which is building resources in diverse geographic environments. And this was actually a great program. Dr. Logan, she did our workshops, and this was during COVID. So we had to figure out how can we reach this population in Kanawha County, which is Charleston, West Virginia, which is the state capital. How can we, how can we focus on this population when there's COVID? No one didn't know about COVID at the time. And so we actually addressed poverty, improving community-wide health, stimulating labor force participation. And you can actually find this actual webinar on our Minority Health Institute Facebook page with Dr. Logan that she actually went on there, and she did a fabulous job with the workshops, and we were able to reach a lot of people during COVID about the bridge. And this is a picture with the Governor Jim Justice and Dr. Anthony T. Ward, who's the founder and director over the Minority Health Institute, and Director Joe Upson that actually gave us this funding to focus on revitalization and an effort with the mission of addressing poverty. And Dr. Logan has a link in the chat for you guys to check that out. And so the Marshall University Minority Health Institute, we actually received funding from Unicare Health Plan of West Virginia back in 2019, and they actually gave us $1 million to do a community investment. There's a lot of minority-owned businesses and organizations out there that don't know about how to retrieve or how to obtain funding. And so basically, we want to outsource the funding to the community workers. And so we're talking about environmental health disparities. In the pictures here, these are real life pictures of how a African-American Black couple were living. This is in the 21st century. So we went into this home and we just basically researched the home. And so now we're actually spending some funding to update their home. They were living with mold, asbestos, you name it. And they actually had health conditions because of their home environment. And so we're so happy that we were able to take this home and many other homes in the state of West Virginia, minority population, to fix their homes. And so they may live in urban and rural communities, maintain their aging infrastructure that you see throughout West Virginia that may not be able to handle climate-related events. And such infrastructure can include buildings, utilities, and transportation and healthcare systems. And so individuals in these communities may also struggle to access resources and care during and after extreme weather events. As we know, West Virginia experienced a lot of flooding in the past 10 years, which with flooding brings on what? Mold and other health issues. And they may have limited financial resources or cultural language or citizenship barriers that restrict their access to healthcare, social services, and safe, nutritious food. So we go into these homes, we actually fix these homes so that they become livable homes. And the below pictures are what actually has been done to the home. And we're really pleased to say that we're almost finished with the completion of the home. These individuals can come back home and live in a nice environment to where they don't have to intake the mold and dust mites and what so that Dr. Logan and I have been talking to you guys about. So the intersectionality between climate change and environmental justice. Next, impact of climate change on human health. The intersectionality between climate change and environmental justice, climate vulnerability, if I can speak today, is the degree to which people or communities are at risk of experiencing the negative impacts of climate change. And as you can see, the impact of climate change on human health, injuries, fatalities, mental health impacts, asthma, cardiovascular disease, which includes air pollution, changes in vector ecology, increasing allergies, you name it. I won't read it all, but you all can see the impact of climate change on your body. And where do we hope to go from here? Teaching, college in the community, doing windshield tours, lunch and learn, student involvement, NPH and undergraduate programs to help people know about how they can actually uplift the community and knowing about and educating the community about environmental health disparities. Research. We actually just got completed doing minority health state profile for West Virginia, which that will actually be distributed to everybody in the world about what's going on in West Virginia. Community-based initiatives, community assessments, GIS mapping opportunities, grants, because West Virginia needs more funding, you guys, to basically combat health disparities relating to environmental health. And the list goes on services, doing the community garden initiative, assist communities in growing gardens, test soil and water in the communities that have actually been having issues with their soil and water due to pollutions in the grass and things like that, raise flower beds. And what we can do is host a community garden fair each year, have a mobile food pantry from community garden produce, and physical activity camps to help the youth and all the adults and ages known to man. And thank you. And for more information, please contact Dr. Logan or myself with the link in the bio. And these, of course, are our references.
Thank you so much. First of all, I want to say thank you so much, Dr. Logan and Donna, for doing this presentation. We saw it, and because you are Region 1 members, we had to have you so that you could come and talk about West Virginia and all that's going on, and just some of the kind of unknown information, the misconceptions, especially it being one of the states, I believe in Appalachia, that the whole entire, every county is considered Appalachian. I don't think that exists for any of the other Appalachian states. Most of them it's partial. I know for Maryland, we have 3 counties. So it is not our entire state, but you are unique in that fact that the whole entire state is considered rural. So thank you so much. And just, I guess one of my questions I have is, this work is continuing on, you know, some of the things that you talked about is a continuation of what you're doing. And I know Dr. Logan had posted earlier about that question that I had in regards to the state having their own, like, I guess, mini EPA, and it reports up. Did I understand that correctly? So I'm assuming it reports to the state administration, so like the governor and what have you, and then also is that agency responsible for reporting up to the EPA as well?
Right, that's correct, Faye. So each state has their own entity that reports to like the higher authorities, the EPA, about what's going on in the state. It goes up through the governor, and that's how our state was able to create like this climate change document, if you will, for individuals to really understand what does that look like for our state specifically when we talk about global warming, flooding, all these climate issues that are happening all across the world, actually. But it's just primarily specific to West Virginia, and the West Virginia, I think it's called Climate Alliance, I don't think it's initiative. They really work together with the EPA to kind of help outline our next steps and goals with what we want to see change as it relates to climate change and environmental justice in West Virginia.
Awesome, fantastic. And as far as the funding, I'm assuming that happens federal down. So you get funding from the federal government down to the state level to be able to combat some of these issues. And then I'm assuming some of that is just the state funding, as well as they kind of set aside funds to combat some of these issues. Because although you talked a lot about the coal mining industry, I believe West Virginia is known for being like beautiful, right? It is the mountain state, right? Or something. Yeah, because y'all mountaineers. So
Yes,
even though there's a lot of issues that exist within that, it's still what, wild and wonderful West Virginia? Is that still the slogan?
That's right. Wild and wonderful West Virginia. Yes. You know, I love my state. I'm born and raised in Huntington, West Virginia. So I am a mountain mama. And, so yeah, our state is still beautiful. You know, we've come a long way. We still have a long way to go. But with strides and changes to policies and having this forum to let people know what's going on in West Virginia and let them know that we support any changes in diversifying West Virginia. It's always, a plus to West Virginia. It's still wild and wonderful and beautiful, though.
And I know we gave a lot of information about African Americans because were the next highest, I guess, number in minority population, as far as ethnic and racial. But then I'm assuming that those statistics probably get worse when we move on to some of our other racial ethnicities, Native American, Hispanic, Latin, American, and like all of those as well. I know they may not be largely represented due to population statistics, and a lot of times, I don't want to say they're not counted, but they're a little lost in that sometimes because their population is so low. A lot of times they're accounting for 1% or less, but I'm assuming that they have just as worse, or if not more tragic statistics than other ethnicities.
Right. In fact, when I was doing research back in 2018, when I first took the role over as coordinator for the West Virginia Minority Health Initiative, I was talking to census, and they informed me that the Hispanic population, which is an ethnicity, can count themselves as white or black. So, and that number, of the white Caucasian population, I'm pretty sure has increased because, they can't count themselves white or black. And I thought that was very interesting to know that because I had not known that previously.
And I was going to also say too, West Virginia is unique in our data collection. So if you look at like our births or the behavioral risk factor surveillance systems and other assessments that we have done, because the minority population we talk about, specifically race, ethnicity, is so small, they combine a lot of the race and other ethnic groups together. And so it makes it hard to kind of separate or identify what the real issue is among each different group, right? So, a lot of times, like I said, when you look at those reports, they'll have like whites, and then they may have just like other race ethnicities, and that's like African Americans, your Hispanics, your Asian Pacific Islanders, everybody's grouped together because the numbers are so small, and a lot of times you can't even really do like the statistical analyses that you need to do to kind of address some of the issues, just for various sampling reasons. So West Virginia is very unique, is what I'll say.
Yeah, I could see that. I could see them kind of combining. I know we were looking once or I was working with someone who was looking for maternal health uh, disparity information for African American, and said that when she contacted the state, they told her it was just too low. So they just lumped it in entirely, and she could not actually tease that out to look for African American because they just didn't have what they felt like was a high enough number to put out there and represent that. And it's, as a solo number. So that's probably a challenge as well. But when they start to do some of the white persons, so do they do that then by socioeconomic income? Because I know a lot of times for you guys, the minority is lumped into socioeconomic. So like below poverty line is counted a lot, which represents a significant number of persons in your state, right? But most of that is might be Caucasian folks that fall below the poverty line. Is that correct?
Yes, and another thing, I know there's just been a lot of, challenges, like you said, Faith, with collecting data when individuals, for example, when we talk about infant mortality, we know that we see the numbers. We see the 12.3% of Black African Americans are suffering from that. And as you all can see, my son was in the slide with the tubes on him, so I even experienced that. So we know the numbers are there. And I was just one, but talking with other women of color, we know there's more numbers out there, but is it being collected properly is some of the challenges, like you said. And I think roughly when we talk about a minority, for example, 66,000 people is a lot of people to me.
Yeah.
So I think that doesn't just need to be a number, it needs to be collected, appropriately. So those are some of the challenges with actually having minorities be accounted for in West Virginia. So like I said before, we have the environmental justice and awareness being brought forth right now. So we do have a long way to go with collecting data on those fronts.
And I have one more question too for Dr. Logan. So, with your work being in the health professions, is there environmental classes or something, like when we're training these future health professionals, are we talking, or is there classwork or coursework or something that is involved in the environmental health challenges and environmental justice challenges?
Right. So yeah, so I primarily teach in our undergraduate health science program, and I also teach our graduate students in the Masters of Public Health program. So I know specifically for my courses, everything is like on the front lines, boots on the ground running, right? So my students work on projects throughout the entire semester, tackling some issue, whether it's environmental, a health disparity, whatever, in the state of West Virginia. We work with policymakers, even with our West Virginia Take Back Our Health West Virginia initiative, we give out grants to our students to specifically address environmental injustices that's happening in our state. We do a lot of work in collaboration with WVU on that project. They're the main organization who houses that project. But we have a lot of different things that we do with our students. They're involved in our community gardens. We actually put them out there and make them, gain some of these valuable skills that they need to put on their resume, and just opportunities to write grants, go to conferences, on the work that they've been doing, not only in my classroom, but in the community, working with LaDawna as well. She knows my students come by her office all the time and try to just see what they can be involved in, and all these initiatives that we do.
Wonderful. Well, I just want to thank you two both again for being so receptive, for getting my out of nowhere email, like who is Faith Steele emailing us, asking us to come and do this webinar. So I just want to thank you guys again for just being willing to come on and talk about this and just kind of highlight, some of the challenges that West Virginia has, but also just some of the, there's hope and there's opportunity. A lot of times with our Appalachian state, I'm a Kentucky native, we are honestly most of the time at the bottom. So a lot of our information that we're giving out is quite it's sad, but there are places where we're making strides. And just thank you so much for your willingness to talk about this, make your contact information available so people can reach out to you and let you know. Like, particularly, we got a lot of librarians on this call that if they want to hear more information, want to see how they can get involved, some ways. And then I will also I'm going to add to the chat really quick. We have a course here that we've offered. It's on demand for NNLM. It's one that April co-created with another person in our organization for an environmental health and justice primer. So if you haven't taken that and you're interested in it, attendees on the call, it is on demand. You can do it at your own pace, and you can come on and just kind of, learn more about some of these issues that Dr. Logan and Donna talked about. Also, if you're a Region 1 member, and if you're not, please visit our Facebook page as well, because this month we're featuring a question where we want to hear from you. Which environmental determinant of health impacts your community the most? Is it air quality, water quality, climate change? I believe soon we're probably going to talk about some issues related to disaster and transportation. We see the collapse in Philly that they've had on the highway. And again, that's that environmental built structure that you're talking about, and cleanup and those types of things also kind of fall into that environmental piece that helps us. Thank you so much, Jean, for publicizing. Yes, I put that in our newsletter this week that the American Public Health Association is offering this application for the stipend to attend the conference. So it's there for Jean's contact information as well. If you subscribe to our newsletter, it's in there as well. And if you haven't already done so, please fill out our webinar survey where you get your MLACE code. Again, thank you so much, Dr. Logan and LaDawna, and we're going to have you back. So make yourself available. So thank you all for coming, and lovely. We'd love to see you all again.
Thank you. And just say really quick, I also posted a link. Our APHA is having, if you know of any students who are interested in climate change, climate justice, environmental justice, we have, I think it's our third go around for students to be able to apply to be an award recipient for a Student Champion for Climate Justice Award. Marshall University was one of the first universities to win this award with my students. And so I'm looking for people to apply so we can award many other universities across the different states this Justice Award, where the students actually put on different climate change events and environmental justice events for their state.
Thank you so much. And if you don't mind emailing that to me, I'll push it out some other ways as well.
I will. Thank you.
Thank you all so much. Have a wonderful afternoon. Thank you, everyone.
Be
Thank
safe,
you.
everyone.